Imagine a little girl looking forward to her first baby. She says goodbye to her husband. He's a farmer. And she said, I'm having labor pains, and I'll have the baby by tonight. But she doesn't have the baby by tonight, or the second day, or the third day, or the fourth day, or the fifth day. Then she delivers a dead baby. Then she thinks, well, I've lost the baby, but I'm alive. But she wishes she had died with the baby. Now she's losing all her body waste down her legs. To see her ruined would touch your heart. A beautiful woman, just because she had a baby that was too big, or she was too small, she couldn't get it out.
Thousands of women in third world countries are impacted by the horrific effects of obstetric fistulas. They have endured days of labor that results in a stillborn baby and incontinence, the loss of bladder control. They become outcasts of society. Dr. Catherine Hamlin has dedicated her life to these women. Catherine was born on January 24, 1924, in Sydney, Australia. She graduated from the University of Sydney and went on to graduate from its medical school in 1946, which, during this time, was a rare occurrence among women. She then went on to become a resident at the Crown Street Women's Hospital, where she met her future husband, Dr. Reginald Hamlin. They married in 1950 and shortly after had Richard, their only son. Their lives would be forever changed when they accepted a 3-year contract from the Ethiopian government in 1959 to work as obstetric gynecologists and establish a midwifery school in the Ethiopian capital, Addis Ababa. Before they arrived, they had only heard about fistulas in textbooks, but they soon discovered how prominent they were in Ethiopia. The obstetric fistula is caused by a long obstructed labor that occurs due to the lack of proper medical treatment.
When it gets beyond this normal stage of labor, then there's a problem. So the baby's not coming out of the uterus or the vagina in a timely fashion. So when the head gets stuck in the pelvis, it causes pressure on the organs that are there. So when the baby's head is pushing on the bladder for too long, it may cause the blood supply to the bladder to decrease. And so then there would start to be something called necrosis, which is when the tissue starts to die because of bad blood supply.
After the still delivery, a hole known as a vesico-vaginal fistula forms between the bladder and the birth passage, leaving the women incontinent of urine. Similarly, a hole known as a recto-vaginal fistula can form between the rectum and the birth passage, leaving them incontinent of feces. The women often will develop one or both of these fistulas.
They have no access to maternal health care and no one to help them with delivery. So it leads to incredible psychological trauma on top of the physical trauma.
The women lack control of their bladder, which results in a constant odor that is unfit for society. Some people even believe that they are cursed. They become ostracized by the community, and many lose their husbands and end up living alone in a small hut for many years.
So many beautiful young girls that are dying in childbirth, but those that are not have had this double whammy of losing their child and then they're ostracized.
በመኪና ውስጥ እንኳን ራሱ እንደዚህ ሁኜ እንዲህ አርጓ አፍንጫቸውን ይዘው ሲሉ ወይድሊ ቅስሜን ክት እንደዚህ እንደፈስ ስለኖርቱ ዛሬ እንደውም
They rarely venture out because of their shame, and about 97% of these women live in a state of depression, often laying in the same position. This causes the muscles and bones in their legs to waste away, which makes it very difficult and painful to move. After discovering how devastating the effects of fistula are, Catherine and her husband decided to stay in Ethiopia and dedicate their lives to the plight of the fistula patients.
She came to start a midwifery college or to help setting one up, and that didn't happen because she got so distracted, and so her heart was so taken by the plight of these particular girls because they were kind of the lowest of the low. They were completely not even taken into hospitals. They smelled so badly.
Instead of immediately starting the midwifery school, they founded the Addis Ababa Fistula Hospital in 1974. This is the world's first hospital dedicated specifically to the treatment of fistulas. and it provides a safe haven for the women. It is completely free of charge, and many of the patients stay for 5 to 6 weeks. While working at the hospital, the Hamlins developed and perfected a new surgical technique for fistulas that is successful in 93% of the cases. They also took trips to raise awareness of obstetric fistulas, as they are unheard of in first world countries, and to inspire donors to fund the hospital. Throughout her time in Ethiopia, there were periods of violence and unrest, including an Ethiopian civil war. Most of the other foreigners left Ethiopia because they were resented. Many were killed, but Catherine did not let this deter her. She stayed and was able to continue transforming the lives of the fistula patients.
They stayed here when most foreigners then left because they kind of had to. Many had to. It was a really troubled time. A lot of people being killed, and foreigners particularly being resented, and many just left. But Catherine and Reg did not go anywhere. Catherine tells stories of delivering a baby and bullets flying over her head, and it's true. She just stayed, and when so many gave up.
Sadly, Reginald passed away in 1993. This was very hard for Catherine, but she persevered and continued to devote her time to the hospital.
And what's extraordinary is that the sort of behind the scenes leader that Catherine was made herself an in front of the scenes, person, because she saw the need. She didn't want it to end with her husband's death.
Now the Fistula Hospital is still in operation. They treat over 2,800 patients per year. After their surgery, many of the patients stay to recover and to receive physical therapy. Dr. Hamlin has inspired many of the patients to work in the hospital or to become midwives.
But we don't just treat a hole in the bladder. We treat the whole patient with love and tender care, literacy and numeracy classes, a brand new dress, and money to travel home. Dr. Catherine Hamlin.
While Dr. Hamlin no longer performs surgeries, her legacy lives on through her accomplishments. Along with the Addis Ababa Fistula Hospital, there are 5 regional centers throughout Ethiopia to increase the amount of women treated, because it is often hard for them to travel the long distance to the main hospital. The long-term or incurable patients stay at Destamender, a farm and training facility just outside of Addis Ababa. Here they gain independence, learn skills such as business management, and have access to medical care and equipment. It is a place where they will not be ridiculed or neglected. The Hamlins' original intention was to train midwives, and in 2007, the Hamlin College of Midwives was established. High school graduates are trained there for 4 years until they are sent throughout Ethiopia to provide care for women in labor. The college is an important step in the eradication of fistulas because the midwives are trained to give proper maternal care and recognize that the mothers need medical attention when something is wrong with the birth. If the obstructed labor can be prevented, then the fistula will not develop. Catherine's phenomenal leadership was recognized when she was nominated twice for the Nobel Peace Prize, in 1999 and 2014. Although she did not win, her nomination recognized how she dedicated over 55 years of her life to treating the women terribly affected by fistulas and giving them new life.
እንዲያረጉና ተሰፋሁኝ ኖርማል ሰው ተጓደኞቼ ታክዬ ጨቄን አዲስ ለብሼ እንደዚህ ተጓደኞቼ ታከሉ።
Dr. Hamlin just turned 91 years old. Her goal is to eradicate fistulas completely from Ethiopia. Dr. Catherine Hamlin has shown exemplary leadership through her work in Ethiopia. She perfected the fistula surgery and founded one of the leading fistula hospitals in the world, where doctors from around the globe come to learn the fistula surgery. She has paved the way to the complete eradication of fistulas from Ethiopia by founding the Hamlin College of Midwives. Her dedication to her work and the women affected by fistulas sets an example for people who want to make the world a better place. She is not only leaving a legacy through the founding of the hospital and the College of Midwives, but her legacy will also live on through the thousands of women whose lives she has touched. She will also leave a legacy through the midwives she trains and the awareness that she has brought to the issue of obstetric fistulas.
But talk to these shy, despondent outcasts who are reborn in the Fistula Hospital here, and you'll realize there is no higher mission, and that Dr. Hamlin is the new Mother Teresa of our age.